All because of the chocolate cake with fruits in it. What
Yeah.
the magic it is creating.
Okay, we are live. I have this gut feeling that you are going to laugh a lot in this class, but it is still okay.
Yeah. Good evening, everyone. I welcome all of you to this masterclass number 88. And we are having an embryology topic of oocyte freezing, which is supposed to be the toughest the skill in human assisted reproduction. So I welcome Dr. Jay back again from Bangladesh. He has had, I think, a great run there. He has successfully completed almost like close to 14 cases, and majority of them which were abandoned. I think that is some achievement in a different country with different variables, and coming back and doing a topic like oocyte freezing, which is I think which requires the highest of the skill as an embryologist. I think it's a very commendable thing. So I think this area of oocyte freezing is not much explored by many, and I think it is because of the lack of practical knowledge and also lack of exposure to people who are doing it successfully. I think because of the good load of work to Dr. Jay because of social egg freezing, and he has been promoting it on the social medias, and now there is a lot of awareness, and he does a lot of malignancy surgeries in young girls. So he has been doing it for quite some time now. So over to you, Dr. Jay.
Yeah. See, I will go to the screen sharing. It's visible, no?
Yes, yes.
Okay. Okay. See, whenever we want to try and discuss basically protocols, okay, for egg freezing or ovum freezing or whatever, okay, it's important to understand this very, very important thing. How you start the treatment, how you do the stimulation is extremely important in this case. Why? Why is it such an important thing to do it in egg freezing? Because you are only going to be able to freeze metaphase 2 oocytes. Okay, freezing of germinal vesicles and meta 1 oocytes is basically metaphase 1 oocytes is basically impractical. So people may say no, but I am so great. And when I find GVs inside, I do culture and I culture this and I do something called as IVM in vitro culture media. See, the problem with IVM culture media is then the oocytes which you get, and if you freeze them, it is practically very, very, very tough for you to do it. All right. And it's virtually not very effective either. Okay. So practically, people don't really want to use in vitro maturation. Okay. Of course, there is a protocol to convert GVs into metaphase 2, and that is a protocol where you take HMG 75 international units in culture media, okay, and you just culture it for approximately 12 to 16 hours, and you will see that some of them will form into metaphase 2. The possibility of going into metaphase 2 is approximately 50%, but it may be a metaphase 2 oocyte with a abnormal spindle, and abnormal spindle is not going to help you any which ways. As a result of which, your stimulation should be able to produce excellent metaphase 2 oocytes. Now, whenever you try to do egg freezing, basically, broadly, if I divide, it will be into two conditions. One will be social, okay, and the second will be in cases of malignancy predominantly, or in any form of other medical health disorders. Okay. In malignancy, it's simple. You have to do something called as RST, that is random start protocol. Okay. Random start protocol. And in social egg freezing, you can aram se do something called as double stimulation protocol. The reason why I'm trying to tell this to you is predominantly you are going to find when you do social egg freezing, usually the age of these women will be more than 35, and 80% of the women will have AMH less than 1.5. Okay. Trust me, when they come for social egg freezing, it's not because they really love you. It is because they have done something and they have realized that their AMH value is on the lower side, and then they have come for doing the egg freezing. Out of that, when you do a dual stimulation, you are going to save her time, and you are also going to give her a short time interval of stimulation, like in a single month interval, you will get approximately 12 to 13 oocytes. The target always is to have approximately 12 to 16 oocytes. Okay, 12 to 16 metaphase 2 oocytes. Okay, as a result of which your protocol with which you stimulate is extremely important. Your trigger, okay, is very, very important. And practically the trigger of choice in this situation is going to be either a GnRH agonist trigger, okay, or a agonist trigger plus a 10,000 HCG, which is also called as a dual trigger, one of the two. Okay, remember one thing, every follicle which you see in the ovary, if I just draw an ovary for you, okay, to make this really cute, okay, I'll just want to tell this to you, because a lot of people don't know this. Lot of people, I hope there are some embryologists also who are watching this, and they can also help me share some of their wonderful inputs, because they are all super champions inside all of this. When you look at the ovary, and when I give the final trigger, there should be follicles which are going to be like this. Some are going to be 18, okay, some are going to be 17, some will be 19, some will be 20, 15, 16. These two guys also should be able to give you metaphase 2 oocytes. Okay, as a result of this, in this situation, a dual trigger may be of great benefit. Okay, stimulation protocol, we have almost always standardized this to letrozole 2.5 plus HPHMG 375 international units. I don't really care what is the AMH at this egg freezing. I want to give this dose. I want to ensure that I get 12 to 14 metaphase 2 oocytes. What typically happens is when you are doing that coming, pick, drop, and all those things, when you are doing the oocyte pickup, what is going to come out is actually a COC, which is a cumulus oophorous complex. So it is going to have an oocyte inside. This oocyte would have matured. It would have had a polar body which has been extruded here. Okay, and it is going to have surrounding cumulus cells. Now remember one thing, these surrounding cumulus cells are not very great, because these are going to be present in hundreds of its counts. And when they are present in such a high concentration, it will not allow equilibration solution and vitrification solution to penetrate to the oocyte. And if you do cumulus freezing along with the oocyte, basically all oocytes will die. Okay, so you need to do something called as denudation. Denudation is a process in which you are going to add some hylase to it. Okay, you are going to add hylase to the media, and you are going to rinse, okay, inside this. So there are many methods of doing this, but I will just tell you one thing. Hylase, we always add 2 drops in approximately 200 microliter of culture media, and we keep it inside the hylase for approximately 30 to 60 seconds. The reason why I'm telling this is because excessive exposure to hylase will also cause damage to the spindle. Okay, excessive hylase will cause damage to the spindle. That is simply not recommended. Then you will get, after denudation, an oocyte which is present like this. It is this oocyte which is completely free of cumulus cells, okay, which is the ideal oocyte, and it has a polar body. Okay, this is something called as a metaphase 2 oocyte. Only a metaphase 2 oocyte will have a polar body. Metaphase 1 oocyte is basically not going to have a polar body. Okay, and when you see this metaphase 2 oocyte, you want to put this metaphase 2 oocyte into a culture drop for equilibration and vitrification. So normally this oocyte is then incubated. I will just draw this oocyte. It is a very simple procedure from here on. This oocyte is basically kept in the incubator for approximately 2 hours. Obviously, guys, you are going to grade the oocyte. Okay, so how do you grade the oocyte? Basically, 2 important things. Is the polar body seen or not? And how is the appearance of the cytoplasm? The cytoplasm should be a beautiful, mildly granular cytoplasm. If you have used the drug in excessive concentration, it will be a dark cytoplasm. And sometimes you will have these cytoplasmic droplets and vacuoles which are moving inside the oocyte. Okay, that is not a very healthy thing for the oocyte. So it should be a uniform cytoplasm. Okay, and it should be a normally sized zona pellucida. So the zona pellucida should be normal. And another important thing, the distance of the oocyte from the zona pellucida should be absent. That means there should be no membrane which is present in between the zona pellucida. It should be a flat line, and usually that is a very, very good oocyte. Okay. Now, this is something which you have to keep in mind. Then, after approximately 2 hours of incubation, you are going to take it in a dish, and through the dish, you are going to have two droplets. One is the equilibration drop, and one is going to be the vitrification drop. Inside this, you are going to place your oocytes. Usually, you will be placing 3 to 4 oocytes in a single drop. And when you vitrify, you will equilibrate it for approximately 10 minutes. Vitrification is for approximately 1 minute. And usually on a straw, basically, which is a cryolock, you will try to have approximately 3 to 4 oocytes and not more than that. So when a patient is in a standard procedure of forming 12 to 16 oocytes to be preserved, it is important that she may form approximately 3 to 4 straws. Okay. Now, these 3 to 4 straws, when you thaw them, remember, after doing ICSI, I mean, prior to doing ICSI, they will require approximately 3 to 4 hours of incubation. Now, this is very, very important, because if I draw the microstructure of this oocyte for you, this oocyte is actually going to have a spindle cell which is present. So if I just draw the oocyte for you, I'm just going to enlarge it and draw it for you. This is a little technical aspect, friends. So some of you may not like it and may not be really interested also, which is completely okay. You have the polar body which is here. Okay. So normally the spindle is going to be arranged approximately 35 degrees away from the polar body. You know, we have this spindle view also in order for us to see how the spindle is arranged actually. All right. But it is not of great help, because anywhere where you do ICSI, just remember what is important is this spindle should be intact. Okay. And if the spindle is intact, then usually the fertilization rates is good, and usually the blastulation rates of the oocyte is good. Okay. But what typically happens, friends, as these oocytes are frozen and then they are thawed, usually fertilization rates will be approximately 70 to 80%. And usually you will be able to achieve approximately 20% live birth rates following these oocyte vitrification. And again, remember, all this is again going to be dependent on age of the patient. So if the age of the patient, especially in India, exceeds 35 years, this result was dropped down to about 10%. And if the age is below 35 years, you can expect a 20% live birth rate. This is what you need to give to the patient in writing. Majority of the times, what is also very, very important for all of you to understand is that freezing of the embryo, if the couple is married and if they plan to stay married, okay, but not have children immediately, then freezing of the embryo is a much better option, because vitrification and thawing of the embryos usually is going to provide you a survival rate of approximately 98 to 99%. The survival rate of these oocytes, as I said, is age dependent, and you will have approximately 10 to 20% of the oocytes which will undergo fragmentation, which will undergo a dark cytoplasm, and which will be unviable for doing ICSI. And that is a real risk of this procedure which you are running. So you must keep this in your mind prior to explaining it to your patient. Okay. So with this much basic information, I finish, and probably I'll answer 2-3 questions of Shilpa madam.
Yeah, so you told that you would give either only GnRH agonist or GnRH agonist with HCG as a trigger. Why not only HCG? Is it allowed?
No, I don't think only HCG is good, because I might want to do a dual stimulation on most of these patients, madam.
Okay.
Okay. Yeah.
Okay. And why the oocyte freezing, though it has been there for more than like 35, 40 years, why is it not so popular like embryo freezing? I mean, what are the
Number of cells is less, no, madam. Oocyte is one cell. So when you have to freeze one cell, it is a tough thing. It is like doing sperm VD. See, when we are doing sperm VD, we are freezing approximately 60 sperms on a single VD device. Okay, approximately 20 sperms per drop. Out of this 60, only 40 will survive. 20 will die. Same thing happens to single cell, which is why embryo is better. Blastocyst is better because it has got 125 cells. Okay. 2-3 cells mar bhi gaya, then also it is no problem. No, another 123 are totipotent cells. Okay. With the egg, what happens is everybody is, I mean, all egg is only one cell, no?
So, what is the consideration of the size and permeability, the shape? I mean, so much is written about it in the theory, like because it is spherical, the surface area is like this, and permeability is so poor, so the vitrification media doesn't enter so well. So,
I told you, just remember the distance between the zona till the inner cell. If that is okay, then that is okay. Forget getting into spherical, pyramidal, and all that. No need to get into all those things.
okay, so I know that you do a lot of social egg freezing, and you tell that ideally there should be about 12 to 16 oocytes. But what is the cutoff for the number of stimulations? See, when we see these girls who are like,
Women, you know how they are, no? You are also a woman only. So normal situation, what is going to happen is once you have told them 12 to 16, and in every stimulation, if they give you one oocyte, no, they will be ready to do 15 stimulations. Boyfriend is paying, no? So no problem. Okay. If they have to pay out of all these things, no, they will only do half stimulation, and that to bargain at the cost of HMG. But what is important to understand is, see, you have to give this target, because sometimes in women with very low AMH, it is going to be that she may require 4 to 5 stimulations. And that is the most common social egg freezing. The people who have 20 eggs, no, AMH of 5, they'll be like, oh my gosh, I'm such a good reserve and all these things. I might find my Mr. Right in the next year only. That next year happens after 1 decade. Understanding, by that time, their AMH from 5.0 has become 0.05. Then they will wake up. And now they will come for egg freezing. And by that time, they will realize that, array, that time if they would have done, it would have finished in a single stimulation. Now it is not going to finish. So, but this is a common problem. This is a very big problem. People who are doing social egg freezing very routinely. See, today we had one patient. We will have one patient for egg freezing every day. So today we had one patient, wonderful lady, beautiful lawyer, not beautiful, but lawyer. Okay, she came. She is telling, I want to do egg freezing with you. I said, okay. What is your age? 41 only. Okay. Like how we write in that check, no? 1 crore only. Like that she's saying. 41 only. Said, okay. We will do your AMH. Yeah. I just tested it 6 years back. Said, okay, very good. How much was it 6 years back? 0.4. I said, unbelievable. Let us see what it is today. And she has been taking medications on her own. Like they love to self-medicate, no? So she's doing yoga. Then I think she was also eating vinegar. I said, very good. Have a bath in vinegar. Okay, for 6 months. Then her AMH came. It was 0.01. Okay. Then we said, we'll do your FSH also. So we said, okay. It was only 94. Okay. So I told her that, look, you have gone into ovarian failure. And she started crying. That, oh, why it happened to me? I wasted 4 5 tissue papers on her. But she was not ready to listen only. Okay, this is the biggest problem which is happening in social egg freezing in today's time.
Yeah.
And remember one thing, when they have low AMH, they require multiple stimulation. So cost of freezing 12 to 16 eggs is going to be approximately 6 to 8 lakh rupees, which is very heavy cost. Understanding? Which also most of the women cannot afford, which they cannot afford. If they can do something in 2 3 lakh rupees, they want to freeze. So it is a big headache, trust me.
No, but how do we counsel patients? Like, I mean, we get this very often, like who are like, around 39, around 40s is when they suddenly wake up, and when they will start realizing that their biological clock is ticking and they have to go right this cycle. Otherwise, like, they will miss the bus. That kind of an attitude they will have. And they will come, they will do all the
And
tests.
that is after missing the bus of 6 years. That is when they will wake up.
True. I mean, this is a common scenario, like, who turn up to the clinics. So we get these one set of patients who are desperate to do it, but there is nothing there. The another patients are like, who are around 28, 29, and who are not sure whether they really want to get married or not. Good AMH.
They want to be mentally ready and think about it.
They want to be mentally ready. They want to, like, ask their neighbor, ask their like laundry person, everybody, and then decide whether it is the right time for them to do it or not do it. So,
Correct.
isn't there a way that we can strike a balance wherein we can bring an awareness that if you do it at the right age, because as you said, age is I think, a confounding factor in all this, where that makes a lot of difference in terms of like the oocyte recovery and also the quality of the oocyte, the chance of fertilization, and then the live birth rate. So,
Yeah.
is there a way where
No, I'll tell you. See, I had actually for a very long time, for almost 4 years, I was only doing egg freezing for oncology patients, because those are the patients who will actually listen to you. Okay, what typically happens in social egg freezing is, no, madam, they all have information, but they have no knowledge, understanding, and they think that the information which they have is knowledge. Okay, so what typically happens is majority of them, they end up making stupid mistakes only. I'm sure this aim at 0.01, she will go to some other clinic and that person will tell, of course, sweetheart, we will freeze 25 eggs for you. You know, something like that. And such stupids will spend 5-6 lakh rupees there, but I don't like to do it that way. I have written it on her paper that you are in ovarian failure. No point going ahead with anything. Unfortunately, she wasted 5,000 rupees consulting me. Now go home. Okay. What is going to happen is definitely she will not listen. I know how it is. She will do 2-3 cycles at some place. One oocyte was found, one was found, one was found. Like that, 3 oocytes will be found. She will have no money to preserve further eggs, and all the money which she has wasted in that egg freezing, because that clinic would have mostly lied, and now she will have no money for marriage also. Understanding? So usually what will happen is these women end up nowhere, is what I have seen, which is why I was against it, because I hate it. I just hate it. Okay.
don't
And
you
I don't like it.
Yeah. So don't you think we should have a age cutoff wherein we say that we are not going to freeze beyond this point?
The problem in social egg freezing is it is social. So you are supposed to do it, and you are supposed to give the lady an option when she wants to come ahead and do it.
Okay. And tell me, this is from the patient's perspective, and I know you are an embryologist yourself, but majority of the embryologists are very reluctant to do the oocyte freezing, as far as I
Yeah.
have spoken. So it is
Nobody
because,
likes it, madam. It is a dhabba on their reputation. If you do oocyte freezing, it is a I don't know the English word. Okay, it is a like a तेरे चरित्र पे एक धब्बा लग गया types. Because when you do oocyte freezing, and if by mistake some another embryologist has come to thaw it, 100% he will put a matches and go in that laboratory. कि किसको बोला कि तुमने एग फ्रीजिंग किया था? 10 एग में से 2 ही निकला. अरे उसके हाथ में मिस्टेक हुआ है. He will not tell that. And that fertility specialist who is very busy, that they don't even have time to enter their laboratory, will be like, oh my god, that guy cheated me, you know. So such type of things are very, very common, which is why practical scenario is they don't like to freeze oocytes.
Okay. Okay, fine. Yeah, I'm done.
Okay, thank you.
Thank you very much. It was very, very, very